Hello, my name is Melda Lungwa and I'm with my brother Shelton Ivan Lumanga. We were both detected as sickle cell disease. We started with small medicines and we were getting ready to come here.
So these two little kids came to us with a diagnosis of sickle cell disease. Both of them came to us for a curative treatment.
So first we started with a doctor from Congo. We started and I was having always after 1 month, they used to change my bloods after each month, and I was always getting sick with some painful sickness. So sometimes it was at school, I started fainting and it was complicated.
When they reached us, we evaluated all of them. So both of them have quite significant symptoms related to sickle cell disease, warranting a bone marrow transplant. We screened the other siblings for a potential match, and we were fortunate to find a HLA identical donor for Shelton. But for Melda, there was no HLA identical donor identified. So we had a discussion with the parents and told them the option that for Shelton, we would like to go ahead with a matched sibling donor transplant. But for Melda, in the absence of a HLA identical donor and because of her symptomatology, severity of the symptoms, we would like to consider haploidentical transplant.
My treatments and my brother's treatment is done. Now we feel much more better. I don't feel again those pains which I had before. And I don't feel again headache, fainting, I don't faint and all. Fever, not much.
So we took Shelton first for HLA identical donor transplant. It was a pretty standard risk transplant. We did the transplant. He sailed through the transplant pretty well, not much of complications. After some time, there was a slight drop in his chimerisms, for which he required 2 sessions of DLI, which he tolerated well, and after that his chimerisms are coming back to normal. For Melda, as it was a haploidentical transplant, so we had to plan it very differently. So we planned it very meticulously for 2 months prior to transplant. Then we took her up for a transplant, haploidentical bone marrow transplant, using one of his siblings as a partially matched family donor. Melda also tolerated the conditioning well and the entire transplant well, and she was discharged with 100% donor chimerism roughly around day 19 to 20 post bone marrow transplant.
Dr. Gaurav Kharya, he is actually specialist into that sickness. He treated many patients. That doctor, he's nice. He's there whenever you are having a problem. He's always there. Like he helps you even whenever he's traveling, because sometimes he travels out of the country.
As we can see today, both of them, Shelton is almost 150 days post bone marrow transplant. Melda is approximately 110 days bone marrow transplant. Both of them are doing extremely well, and their life has changed quite significantly. They haven't experienced any symptom related to sickle cell disease in the past 4 to 5 months.
Thank you, Dr. Gaurav Kharya, for treating me and my brother and the other patients of BMT which have gone through it. I thank you, all the staff of Apollo and all the doctors. I thank you for the treatment you have done for us.